called disarticulated. So that means separate, not with other bones. So I would show you a bone like this, and you would have to tell me what the name of the bone is, okay? And any important parts or markings, foramen, things like that, sutures that might be visible. You have a list of them in your study guide in the lab manual. So only the ones that I've listed there are the ones that you need to know. The textbook goes through all of the markings, a lot more details there for each bone than what you need to know for this course. But for now, this particular bone, you might know it already, is the bone of the forehead. And what was the proper anatomical term for forehead?
Frontal.
Frontal. So that is the frontal bone. Those anatomical terms are going to come back hopefully to help you here. This is the frontal bone. You can see the anterior portion of the frontal bone. You can also see the regions here, which are the holes for your eyeballs. Okay, this portion right here. You can see the frontal bone on this blown out skull here as well. Each of you, your groups have a skull in front of you. If you would just point to the frontal bone so I know everyone is with me. Humor me on that. Okay. Great. Awesome. Frontal bone. Regardless of if it's blue, right, or white, whatever color, yellow it might be, still the frontal bone. You can still see those open areas where your eyeballs would be here. Okay, the next bone, and you have two of these in your skull. This bone is the parietal bone. Parietal bone. You have two parietal bones. You have the blown out skull. You'll see the two of them at the top. These go with the lobes of the brain. Already looked at the lobes of the brain, and if you remember the precentral gyrus and the postcentral gyrus, the precentral gyrus, remember, was in the frontal lobe, so that went with the frontal bone location. Postcentral gyrus in the parietal lobe. Parietal bone, same location. If we were to go deep to this bone, then you'd see the parietal lobe of the brain. Still with me, everybody?
So there's two parietal.
There's two parietal bones. Correct. Yep. Yep. And they are connected at what's called the sagittal suture. Sagittal suture. So I'm going to hold the parietal bone the way that it should be. And right here is the sagittal suture. Humor me, point to the parietal bone on the skull that's in front of you guys. You should have two of them. Two disarticulated ones. On this skull, you can see the two parietal bones here, and you can see the sagittal suture in the middle of them. Two parietal bones. One of the other clues for the parietal bones is to look for this area here, this squamous suture, which is right near where your temple would be, right next to the temporal bone. The temporal bone isn't on this skull that I have in my hand, but it would be right here where your temples would be. Okay, so if you look for this suture, it's kind of a curve, almost like a rainbow shape to it. The squamous suture here, then it's often a key to help you identify the parietal bone. I'll hold the parietal bone up one more time just so that you can see what I was talking about as far as that rainbow goes.
So it's this.
Okay, so this is right where the temporal bone would be. This is the squamous suture. Yes, you got it. In your lab book, I think the picture that I have of the bone is green. It's like a lime green color, if I remember right. Yep. Like I said, they come in different colors, so don't always go by the color for these bones. The temporal bone on this skull is actually pink.
Which one
Sure. Here's the temporal bone. We were just looking at the parietal bones. Parietal bones on this skull are green. Temporal bone is pink. And you can see right where that rainbow shape is located. We were looking at the sagittal suture over here, and the squamous suture along the side where the rainbow is. All right, now I'm gonna go to the back of the skull. This is the posterior.
Wait, where's the squamous suture and the little rainbow?
Squamous suture is between the parietal bone and the temporal bone. Okay, the back of the skull here is the bone that on this skull is in purple. This is the occipital bone. Again, goes with the lobe of the brain, the occipital lobe of the brain, towards the back of the brain. So here's the occipital bone. One key feature to help you to identify the occipital bone is to look for a big hole in the bone. Very large hole. This hole is called the foramen magnum, or the magnum foramen. I'll take either way. Foramen magnum or magnum foramen. It's this hole here, and obviously this hole is for the connection between the brain and the spinal cord. Looking at the medulla oblongata, connecting with the spinal cord, that is via this hole right here. The brain would be up where my finger is, spinal cord down where my wrist would be located. I'll show you another view of the occipital bone. You can see it here. Again, this skull is plastic, and all of the bones are one piece of plastic, which really they shouldn't be. I happen to like the colored skulls and the skulls that come apart a little bit better. But I can ask either way on an individual bone, or I can ask on the skull that's all together. You should still be able to identify those bones. This is the occipital bone. Right here, foramen magnum. Sherlock, show me where it is on that skull. You got it. Now you can ask me a question.
Where is what's the rainbow thing called?
It's called the squamous suture. Right here.
I thought it was this.
Nope, that's the sagittal suture up here. This part right here, this curve. Yep, sure. Okay, so we have on the blown out skull, or on any of the skulls at your bench, they all have these same bones. Frontal bone, one of them at your forehead. Parietal bones, two of them at the top of your head on either side. And occipital bone, one of them at the back of your head, the back of your skull. Still with me? Yeah.
What is the suture that goes between
The rainbow suture, it's called the squamous suture. Okay, so let's look now inside, of which you can't see on this skull, but there are bones inside here making up the back of your nasal cavity, your top jaw, and your lower jaw. We'll look at one of those bones that's pretty small. Okay. One of the smaller bones that you'll need to identify. This is the ethmoid bone. The ethmoid bone is at the back of your nose. If you have a blown out skull, you may be able to see it if you look towards the back of the nose. Yeah, if you have a skull that is completely together, you won't be able to see the ethmoid bone unless you look in the hole. Correct, you've got it there.
Wait, so it's in here?
Katie has it on her skull and it is yellow.
Oh, that's
Right at the back of the right at the back of the nasal cavity, the back of the nose. So it looks like this. This is the ethmoid bone. We were looking at the olfactory bulb, the cranial nerve 1. And remember we talked about the receptors in the nose that help with the sense of smell. And I said that those olfactory receptors go up through little holes in the ethmoid bone. Those little holes are here in a portion of the bone called the cribriform plate. I mentioned this maybe last week or so. So these tiny holes. Again, this bone is plastic. So, you know, if this was real, the holes would be much smaller. Very tiny holes. This portion is called the cribriform plate.
Oh, that was the calculator and I think that we took apart.
That was we were looking at the olfactory bulb.
Oh, like right.
So if you remember the sagittal face, the sagittal face model, and I'll show it to you now just to refresh your memory, had those small holes on. Okay, so we were looking over here, we were looking at the nose and the olfactory bulb. If you remember, the olfactory bulb itself was up here in the brain, and the holes in this bone are those olfactory foramina. Those are for the olfactory nerve to go up to the brain in order for you to smell. So this bone here in the back of the nasal cavity is the ethmoid bone. That's this tiny one. Over here. The nose model as well shows the ethmoid bone. This bone right here. And these nerves were a part of that olfactory tract for the sense of smell, and they went up here through the holes in the ethmoid bone. So the bone that is showing you here is the ethmoid bone. I'll leave all three of these. Okay, going across from the ethmoid bone, probably an easier one to go to next is the maxilla. The maxilla are the upper jaw bones. You have two of them. In this model, they're colored kind of a teal color. These are the maxilla. These should be easy to identify because there's teeth in them. Okay? There's teeth. This is your upper jaw. And I will not show you a maxilla that doesn't have teeth. There's not going to be any dentures
Where is it?
or anything.
Right here, right?
These are the maxilla, right? Yep. So maxilla on this model are kind of a teal color. Again, here they're not colored, but you can see them clearly. The maxilla here. Two of them, one on the right, one on the left. Sometimes you'll see in the maxilla holes where a tooth would be. Let's see if I can show it on one of these. If you see a hole where a tooth should be, for example, you lost a tooth, now you have a hole there in a socket. That hole is called an alveoli. Alveoli. We'll talk more about that term as we go on, especially in AP2 when we do the respiratory system. We'll talk more about alveoli. But just think of alveoli as an air socket, an air pocket. Okay? You can see it probably easier on this bone, which is a mandible, your lower jawbone. And I'm just going to point to one of those alveolar sockets here. This person lost their tooth, and you can see the hole in the bone, kind of like the air pocket. That alveoli, that hole. You guys see that? Okay. So this is the lower jawbone, mandible. You have one of them. Here's another mandible, neatly intact. Okay. Here's another mandible. Maybe one a little bit smaller than the other, but you know, there's still a mandible. You can see the process over here that's kind of rounded. This process here. This process is going to help to form your jaw. Probably easier if I do this together. Okay, here would be the correct positioning of the mandible. And you can see how this process in the mandible is going to articulate with the temporal bone to form your jaw. Okay. If you've ever had locked jaw, or you've ever had your jaw crack, for example, that's because of this joint right here. Process on the mandible and this indentation here in the temporal bone. see. The other structure in the mandible that you'll need to identify is the hole on either side of the lower portion of the mandible. Now, you might remember the proper anatomical term for chin was mental. So here, these holes are the mental foramen. The little hole, you got it. Yeah. One on either side, mental foramen, right in the area of your chin. So lower jawbone, you've got one of them. That's the mandible. Upper jaw, you have two. That's the maxilla. And then above that, the back of the nose, we just looked at the ethmoid bone. So let's go on then and go again towards the back of the nose and more towards the sides. This particular bone is shaped like a bat. It has wings. Here's a real one. Here's a plastic one. These are the sphenoid bone. You have one of them in your skull. One sphenoid bone. I said it looks like a bat. To me it does. So it looks like the wings of the bat on either side. Okay. These structures here are called the wings. You have greater wings and lesser wings. The large portion that I have my finger on now, these are the greater wings, or the bigger wings. The smaller region here are the lesser wings. The sides of the sphenoid bone are near your temporal bone, kind of right at the area of where your temples are located. And the portion of the sphenoid bone that's facing upwards towards your brain has an indentation. We call it a fossa. This is the hypophyseal fossa. Hypophyseal fossa. And that term hypophyseal might sound familiar to you. Hypophyseal is in line with your pituitary gland. If you remember, the pituitary gland hangs down from the brain, from the infundibulum, that little stalk. The pituitary gland sits in this little fossa, this little hole, indentation, I should say, in the sphenoid bone. So this is the portion of the sphenoid bone that's facing your brain. That's the superior portion of the bone. This portion is inferior. It's going to be difficult probably at the beginning for you to identify, not only the name of the bone, but then to think, where is it? How is it orientated in the skull, in your head? And the sphenoid bone is like this in the skull.
Where the hole is the bacteria.
Not hole, but indentation. Okay, the holes here is the inferior, correct?
These are inferior.
Yes, these holes are sinuses. They're holes in the bone that are covered with epithelial tissue. It's a mucous membrane in this area. You ever had a cold and you feel like you've got a lot of pressure towards the back of your nose? Maybe the doctor will push in, in these areas here. See, does it hurt? If you have an infection there, if you have a sinus infection, then these mucous membranes are going to become inflamed. A lot of pressure is going to build up. Your voice is going to change because of that. So these are the sphenoidal sinuses, these holes in the sphenoid bone here.
Is that this?
You got it.
Okay.
On Katie's skull, the sphenoid is like a red color. And again, you can see the inferior of the sphenoid there. You can take it apart if you want to, but we'll put it together before you leave. If you were to take it apart, you would see this portion of the sphenoid bone and the hypophyseal fossa.
And this thing?
This is the superior part of the bone where the hypophyseal fossa is. It's the little kind of indentation, you got it, for the pituitary gland. So that portion is facing the brain, it's closest to the brain.
So that
That
but
is
what
that,
is the
correct.
difference between these two?
Sure, this view is the superior view, like this, and this view is an inferior view.
What is that called?
A sphenoid bone. Bone that looks like a bat.
I have here hypophyseal
Fossa?
sophisa?
Fossa. Maybe you were trying to spell sphenoid? Hypophyseal fossa. Fossa is F-O-S-S-A. Fossa. S-S-A.
So hypophyseal is right.
Right, hypophyseal
that.
fossa is this part here.
Right, okay.
These are the sphenoidal sinuses, so your label's correct.
Okay.
Yeah, I
This
would just
needs to go
cross
up
this
here.
out.
Okay.
The other name, in fact, for the hypophyseal fossa is the sella turcica. So that could be why you have
Oh, okay. Got it.
I think most people will probably find it easier to spell hypophyseal fossa, but that's just me. All right, so we've got sphenoid. Let's see. 2 more bones in the skull. They're both the right side. Okay, look like this. Curve, space. Again, for your orbit, for the hole, for your eyeball. This is helping to form the orbit. Okay, this portion here. These bones are the zygomatic bones. Look in your cheek. Lower portion of the eyeball. Okay, of that cavity for the eyeball. The zygomatic bones. You have 2 of them. 1 on each side. Zygomatic. They're tiny, they're in a box. Okay, on the skull here that is not colored, this is a zygomatic bone. Here's the zygomatic bone.
So your cheekbones?
The zygomatic process, is that the same thing?
Yeah,
Or is that-
zygomatic process is actually here, and that's a part of the temporal bone. But so if you were to put blush on, for example, in the morning, then you'd be putting blush in this area of where the zygomatic process is.
That's this.
That is correct. Yep. So you can see the zygomatic bone and the temporal bone have an articulation. They have a joint with each other. All right? That's this joint that is here. This process is called the zygomatic process. Even though it's on the temporal bone. Still called the zygomatic process because it is connecting the temporal bone and the zygomatic bone. Zygomatic bone, very tiny. As I said, I think it's easy to identify this one because of that curve of where your socket for your eyeball would be. Because we were talking about the temporal bone, I'll go back to it again and show you that process, which is the zygomatic process. We talked about the temporal bone earlier when I said that rainbow kind of shaped suture near your temple. Here's the zygomatic process that's pointing towards the anterior of your face. A couple of them in there. We've done this one. Okay, tiny pieces. Tiny bones. Super tiny. Okay, there are some very tiny bones in the skull. These are 2 of those. I will not ask you these individually like this. Okay? But these are the nasal bones. The bones right up here, the very top of your nose, are the nasal bones. The whole rest of your nose is cartilage. All of this portion of your nose is cartilage. Just right here are your nasal bones. You have 2 of them. I will not show them to you like this on the quiz or on the practical, but you should see them on the blown out skull. Yeah. Kind of a brownish, maybe orangey color, depending on the model that you have. So nasal bones are in the box, the white box in the back here. There's also a couple of other small bones called the inferior nasal conchae. You've heard these terms before. You remember the conchae were those protruding pieces into the nasal cavity. We looked at them on the inside of the nose, for example. You had to know this for your lab practical. We looked at the superior, the middle, and the inferior conchae, and then we talked about the meatus and so on that cause that air to turn in the inside of your nose. Well, the bottom portion here is actually a separate bone. So the inferior conchae are two separate bones. Like the nasal bone, I will not ask you these.
What is that?
Inferior conchae.
Are those snakes?
Yes, they are. But I will not ask you these. They're tiny. Not as tiny as the auditory ossicles, though. Remember, the auditory ossicles are the smallest bones in the body. We've already done those. We've talked about the auditory ossicles already with the sense of hearing. So I'm going to assume that everyone remembers them and knows them. I will not ask you these again. Malleus, incus, stapes, the tiny auditory ossicles, smallest bones in the body. Great. I think we're pretty good with the skull so far. Last one that I will mention, not as small as the auditory ossicles, not as small as the nasal bones. This helps to form your nasal septum. This bone is called the vomer. The vomer almost looks like a V. Here's the vomer. You look at the bottom back of your nasal cavity, that bottom division is formed from the vomer. And you don't have one there. Okay. No. So this is the vomer. Again, it kind of looks like a V here. Goes like this, forms the bottom portion of the nasal septum that divides the nose into right and left nasal cavities. Vomer, I will